Hi, welcome back to Healthcare Friday afternoon, and we are moving to the EMS bill, which is H 622. And have legislative counsel walk us through the bill and go from there. So I'm going to turn it over to Jen.
Great. Good afternoon. Jennifer Carby, Office of Legislative Counsel. I will put the language up on the screen. We can go through it from there. Hold on just a second. What is that? Wasn't at the beginning of it.
And I want to just be cognizant of the time. We do have another topic at 2, I believe. So there'll be plenty of time for us to walk through the bill, and then we'll see how far we get with talking about it. Thanks, Jen.
Sure. So this is H 622. It's an act relating to emergency medical services, and it has several different provisions in it, all related to emergency medical services. The first in section 1 is amending an existing statute relating to the emergency medical services system. So the current section is just entitled policy. This is expanding that to be purpose, findings, policy, and intent. And it adds a purpose, that it's the purpose of the chapter to promote and provide for a comprehensive and effective emergency medical services system to ensure optimum patient care. It gives some legislative findings. That emergency medical services provided by ambulance service are essential services, that the provision of medical assistance in an emergency is a matter of vital concern affecting the health, safety, and welfare of the public, that key elements of an emergency medical services system include the provision of prompt, efficient, and effective emergency medical dispatch and emergency medical care, a well-coordinated trauma system, effective communication between pre-hospital care providers and hospitals, and the safe handling and transportation, and the treatment and transportation under appropriate medical guidance of individuals who are sick or injured. It gives a subsection heading, but otherwise makes no changes to the current policy of the state regarding access to emergency medical services, and then provides an intent statement saying it is the intent of the General Assembly to designate a central agency with responsibility for the coordination and integration of all state activities concerning emergency medical services and the overall planning, evaluation, coordination, facilitation, and regulation of emergency medical services systems. Section 2 has to do with Medicaid reimbursement. This would add a new section in Title 33. In the Medicaid chapter, saying first, to the extent permitted under federal law or waivers, the Agency of Human Services shall reimburse a provider of emergency medical services for delivering emergency medical services to a Medicaid beneficiary who was not transported to a different location during the period of the emergency. So treating without transporting. And the reimbursement would be in an amount equal to the Medicare basic life support rate, which is a specific Medicare rate, emergency medical services rate. Also, to the extent permitted, again, under federal law or waivers, the Agency of Human Services shall reimburse a ground ambulance service provider for transporting a Medicaid beneficiary to a destination other than a hospital when the beneficiary's condition does not meet the criteria of an emergency medical condition as defined by agency rule, and the beneficiary consents to being transported to the alternative destination. It specifies that the ambulance service cannot transport a Medicaid beneficiary to an alternative destination in which the ambulance service has a financial interest. And it directs the agency to adopt by rule a reimbursement methodology for alternative destination transport by a ground ambulance service provider to ensure their rates are reasonable and adequate. Section 3 is just kind of a conforming change reflecting that the addition of that last provision. So it's amending 24 VSA section 2689, which relates to insurance reimbursement for ambulance services. And this would add a provision saying that reimbursement for ambulance services provided to Medicaid beneficiaries would be in accordance with that language added in Section 2. Section 4 amends an existing statute relating to the EMS Advisory Committee, but it turns it into a board and it makes some changes to its composition and its role. So it has this Emergency Medical Services Board instead of Advisory Committee, advising the Department of Health on matters related to the delivery of emergency medical services in this state. Some of the changes are stylistic. So again, we're going from committee to board, and it said include, but it then specified all the members. So I liked comprise better than include, and then made some changes to use non-gendered language. So numbers 1 and 2 have not changed in any substantive way. The third one replaces what under current law is a representative from the Initiative for Rural Emergency Medical Services Program at the University of Vermont or their designee to the chair of the E911 board or designee. And then the rest of the membership is unchanged. Then again, it has the now board selecting its chair from among its members, someone who's not an employee of the state. And then it specifies that the board has the administrative, technical, and legal assistance of the Division of Emergency Medical Services in the Department of Health. And then replaces references to committee with board. And then it strikes this long list of things that need to be included in the EMS Advisory Committee annual report. So instead of all of these items that are currently required to be reported, it would instead direct the board to develop and maintain a 5-year statewide plan for the coordinated delivery of emergency medical services in Vermont. It would require them to update the plan at least annually, and it would require the plan to include specific goals for the delivery of emergency medical services in Vermont, a time frame for achieving those goals, cost data and alternative funding sources for achieving the goals, and performance standards for evaluating the goals. And then annually by December 15th, the board would deliver to the Commissioner of Health and the General Assembly a report reviewing its progress toward achieving the goals in the plan and the goals set and what goals the board has set for the coming year. And then adding to the plan and reporting, but otherwise no changes. Again, committee to board. And that is it for that section. Section 5 creates an emergency medical services task force, and its job is to oversee and manage all phases of the development, design, and implementation of a statewide emergency medical services home in Vermont, including conducting a complete inventory and assessment of all EMS services currently available in the state. The membership of the task force would be the Commissioner of Health or designee, the chair of the Emergency Medical Services Board, that board that we just looked at in the previous section, the Emergency Medical Services Chief at the Department of Health, one municipal official appointed by the Executive Director of the Vermont League of Cities and Towns, and one emergency medical technician or paramedic appointed by the Vermont State Ambulance Association. The EMS task force would be directed to collect data necessary to conduct a complete inventory and assessment of the EMS services currently available in this state, including the number of full-time and part-time personnel currently performing emergency medical services, the current total spending on emergency medical services in this state, with itemized information for each emergency medical service regarding all applicable federal, state, and municipal appropriations and revenue sources, each contract for emergency medical services, and the projected budget for each emergency medical service, and information on all identified gaps in services and overlapping service areas. Directs the task force to provide recommendations for the design of a statewide EMS system, including recommendations related to EMS district structure and authority, which may include recommendations on the number and configuration of EMS districts and their powers, duties, and scope of authority, workforce training standards and other staffing best practices that support the retention and well-being of EMS personnel, a resource allocation plan that ensures emergency medical services are available in all regions of the state, a process for annually reviewing EMS service providers' budgets, a governance model that provides for effective state and regional oversight, management, and continuous improvement of the EMS system, including identifying staffing and other operational needs to support the oversight and management of the system. Cost estimates for implementing the recommended system in Vermont, including operational and capital costs, and anything else that the task force deems necessary or appropriate. It authorizes the task force to retain a project manager and one or more additional consultants with relevant expertise in EMS design and financing. And it gives the task force the administrative, technical, and legal assistance of the Department of Health. There are 2 reports required. The first is due by December 15th of this year, and would have the task force submitting the inventory and assessment to the Commissioner of Health and the General Assembly. And then the following year, by December 15th, 2025, the task force would submit its design recommendations, again, to the Commissioner of Health and the General Assembly. It has the Commissioner of Health or designee calling the first meeting by July 1st of this year. The Commissioner of Health or designee and the chair of the EMS board would be the co-chairs. Majority of the membership is a quorum, and the task force would cease to exist after its second report in December of 2025. It allows members of the task force to receive per diem compensation and reimbursement for up to 8 meetings made from monies appropriated to the Department of Health. And it would appropriate $200,000 to the Department of Health from the general fund in FY25 to support the task force throughout its work. Finally, Section 6 is an appropriation. It appropriates $1 million from the general fund to the Department of Health in FY25 to provide training for EMS personnel. Finally, Section 7 is the effective dates. The act would take effect on passage, except that the 2 appropriations would take effect on July 1st of this year when the FY25 fiscal year starts.
Great. Thank you, Jen. Leslie, the question?
I do. I'm just curious. I know that we're going to be working with GovOps, and I'm just curious to know what are our sections and what are their sections, or
We're going to get to that.
okay.
Promise.
I'm just trying to think about it as I think about it.
Yep. Any questions on the language?
I think my question is gonna need to be for later,
Okay.
but I'll put it out there and then we can figure out where it fits in, which is like, would it be appropriate for our committee to weigh in on the powers and duties since it's related to healthcare practice, like the policy guiding practice? I feel like GovOps tends to be more the structure of boards and commissions, not the policy content. And I feel like because these are healthcare providers, that would it be appropriate when the time is right to, like, I think I want to hear from the witnesses first, but like at some point, and maybe I would ask witnesses questions about like the practice and like it's about the training.
Okay. So yeah. Okay.
So I think it'd be appropriate to ask the providers after they testify, after I hear what they say. But what I wanted to say is the question to Ledge Council is, would it be appropriate for this committee to weigh in on the powers and duties of a task force, since that's related to like the policy that's going to impact healthcare practice?
I will defer to the chair on that. I think the jurisdictional issues are really governed by House rules more than than anything.
Law. Okay.
All right.
Jen, this is for you if you can answer it, and then later for witnesses to I'm assuming, I think I'm hearing that the board will have more authority and teeth than the advisory council did to set state policy and practice around EMS. The fact that it's a board and not an advisory council.
I mean, I think I'm not sure how to answer that question. It's a board and it doesn't have advisory in its name, but it does still have the charge of advising the Department of Health on matters relating to the delivery of emergency medical services in the state. Instead of a detailed annual report, it would be coming up with a plan, which perhaps is more active than advisory, but it still doesn't have, I don't read it as having standalone decision-making authority.
Okay.
Daisy?
Where is I'm on page 3, line 6, little c, policy. It is the policy of the state of Vermont that all persons blah, blah, blah. What is that from? Or is that new?
That's the existing law. So that's the piece of 18 VSA 901 that is existing law. And the rest of it that's underlined is what's being added all around surrounding the piece of existing law.
So my question or concern is that there's nothing in here about being trauma informed. I'm aware that often these are the first point of contact for folks who are in a crisis, and just the tremendous impact and also existing expertise that folks in these roles have. And often they are trauma informed, but also I want to make sure that they have the financial capacity to train staff to be trauma informed. And so is there a way that we can put that in here rather than in the rulemaking process, that is also, I think that's somewhere in our policy around mental health, to be trauma informed.
So I think I'm thinking it would fall under the training part. So we'd have to look at and we are anyway, we're gonna definitely focus in this committee on the training piece, because we recommended the budget, last year for the training. So we want to hear back on what's been happening with it so we can talk about it through that process. But Jen, I don't know if you have a legal language answer to her question.
I mean, I think that if the question is, can you add language? Sure, you can add. I mean, we can discuss any language the committee wants to add. This is just the bill as introduced.
I wouldn't suggest any language until we talk to the witnesses.
Jen, on page 5, line 13. How big is this board going to be? Is there a number of members somewhere?
Well, it has 1, 2, 3. No, it looks like it currently has 9 members, and it would continue to have 9 members.
That's my question. The way that's written, the committee of board shall compromise the following
No,
members.
comprise means be made up of.
Yeah, I'm sorry, comprise. One representative from each
Oh, I'm sorry, from
EMS.
each EMS district,
Yeah,
you're right.
the district.
So it is not changing its size, but I don't know how many EMS districts there are. I bet some of your witnesses in the room or otherwise can give you that answer.
And
Start 13.
13. And so it's not changing the size.
There's 13 districts, so there's gonna be 13 people.
Well,
That's
that's-
13.
13
That's
plus
13 right there,
8.
One,
plus 8, so 21.
which is not a change in the size from what they do today. It's just a change in what they are going to be tasked to do.
Right.
And then there's gonna be one representative from all of the rest of the EMS services that aren't in a district. Is that what I'm understanding?
Not sure I
So,
understood the question.
yeah, no, so we're not, Jen, it's not a question for you. So hold on to that. And we'll come back to that. All right, I have a language question, Jen. So on the section 2, where we talk about the reimbursements, is this just saying we need, that Medicaid needs to reimburse, or is this also commercial insurance?
This is, so section 2 is specific to Medicaid. Section 3 amends an existing section of law that talks about the mechanics of reimbursement from private insurance.
Okay,
But it is not a requirement on private insurance.
okay. But not a requirement, okay. Okay. So, jurisdiction wise, House government operations should be responsible for sections 4 and 5. And so it is the section of the changing the advisory committee to an EMS board and changing its it's supposed to do, its responsibilities. And then section 5, which is creating a task force, which would be new. And so, and then sections, anything having to do with reimbursements would be this committee. And so we can do this a couple ways. We can keep the bill here and work through the reimbursement pieces through our budget process. And section 6, which is the training piece. And then, once we decide what we're gonna do with that, send it to government ops. Or we can choose to give the whole bill to government ops, so they can start working on it when it best fits their schedule, and we don't run into a time crunch. And know that we're gonna look at the other pieces as part of our budget process. And if we decide to move forward with any of it, it would go into our budget letter to appropriations. I don't know
When it's from someone.
if, we don't know yet.
It's not a committee bill, huh?
It's not a committee bill, so we have to meet crossover. And we have to, work in the budget timeline. So, I see two important pieces. One, ours is the budget, which we're in the process of working on now and we'll do for the next couple of weeks. And then the other is that government operations, should they choose to take it up, has the time to take it up before crossover. If we do send it to government operations, then what I would like to suggest is that Leslie is our point person. She's shown a big interest in this bill, that she would work and sit in on that testimony and bring back what we need to know. And I would ask that once Mike has Chair McCarthy has works through the process, if they choose to, that we at least have a briefing on it.
Yeah. So I think this is really important, Bill. The EMS sort of is the beginning of our healthcare continuum and really important in saving lives. We know for hearts, time is muscle, et cetera, et cetera. I would like us to do our work first, get done what we have to do, have it go through our budget process, and then send it off to GovOps. I know they're incredibly busy, and I would worry that they might not get to it before crossover because of the intensity of the work that they have. Whereas if we have our work done, they might be able to slip it in. So that's what I'm wondering.
So my concern is the direct opposite.
Okay.
I'm just gonna put it out there, that if they don't have this bill in hand and they wait until we're done, if we're not done for 2 or 3 weeks, that gives them very little time to dig into the board and then
Totally.
task force.
Get it? Yeah.
All right.
I would leave it totally up to your judgment. Well,
Thank you.
you're in charge of the committee, you know what we want to work on, and whatever you say goes with me,
Fine.
within reason.
I knew there was a catch there.
Yeah, really.
I mean, as long as we get to weigh in on the implications of policy on practice, I'm not gonna make a big deal about the process. In my past, I've been here longer than everyone except Topper. Lori and I have been here as the same time. I think I've been here longer than everyone. We've been here longer than everyone but Topper. In my experience, usually when I've worked on bills that involve boards, commissions, or task forces, the committee of policy jurisdiction does its work and then it goes to them. But they do end up with a giant pile of bills that they have to then get out before crossover. So whatever you and the other chair can figure out to make it happen, I support. But usually the policy committees do weigh in. My concern about things is because I view emergency medical services as healthcare, but government operations handles like the law enforcement and there is like
Well, they handle government structure.
in general, all boards, commissions, tasks, everything that's related to that goes through them to make sure. And I've seen GovOps completely change the structure of a bill, but not the policy content. So I think as long as we weigh in on policy content, if they have to change the structure, I understand. But I guess what I'm getting at is as long as whatever is going to make it happen quickly, I'm fine with. But I just want to make sure we can weigh in on the training parts.
Yeah, so
and making sure that the workers are taken care of.
Yep. So the training and the reimbursements
Okay.
would be our through budget.
Okay.
Is there any reason why we can't work on it at the same time?
That was my question.
Maybe.
Well, someone has to have the bill.
He has to own it, yeah.
We can still work on
But
it.
yeah, we're still gonna work on it because we're doing budget. I mean, so I would rather give them the bill. So they have something behind them to work on it. We always work on budget, right? They don't work on budget. Unless it's within the realm of what they're doing, but like we have the Diva budget. And so we can say, we want Diva to do X, Y, Z.
Mhm.
But they need a bill in order to start taking testimony on the task force and the board.
I think it's fine. I know like judiciary and corrections often are working on the same bill at the same time, and it will be in one committee's jurisdiction and the other committee will be hearing testimony on it anyway and weighing in. And then sometimes it doesn't even have to pass through the committee because the other committee just does it, you know, kind of like figures it out. So however you make it.
If there's a way to do that, that'd be great, because I agree with Leslie, and I think a lot of us that this is an incredibly important service, and I noticed that there are a lot of rural sponsors on there, and I think especially for our
A
rural.
lot of what?
Rural.
Oh,
Rural.
I can't say that word. That's probably why I couldn't hear it.
But yes, I think I'm aligned
Okay.
on the importance of it and however the most efficient way to
Okay.
make sure it crosses over.
So I am gonna talk, I mean, I've already talked to Chair McCarthy, but I will let him know, oh my goodness, I will let him know that I will send the bill to him and then we will make sure that we keep it as the budget pieces of it. Okay. Big delivery back here. Leslie.
I just have a confusion, Jenna, on the language in section 3. I thought I heard you say commercial, but it says Medicaid. I just want to clarify.
So section 3 is making an addition to an existing statute that deals with commercial insurance by adding this reference to say, if we're talking about Medicaid, look to 33 VSA 1901M, which is what's added in section 2.
Thank you.
Yes.
Okay. Great. Thank you, Jen. Okay. I don't think we're on until 2, right? 2:00, Claire? Okay. So anything else on this?
Are we not going to hear from the providers today?
No,
Okay.
we're not going to hear from the.
Really excited to hear.
Going forward. Yes, exactly. I mean, we have 15 minutes if either of you want to say something, I'm fine with that. Never miss a chance, right?
I'm planning to just listen. So Drew Hazelton, I actually chair the EMS Advisory Committee that is proposed to be a board in this bill. Thank you for taking up the bill. We appreciate you guys are looking to kind of help the EMS system. I think I handed out the EMS Advisory Report and hopefully you got a chance to look at that. The EMS system in Vermont is struggling. We're struggling for a lot of different reasons. Some of what we've asked of the legislature in the last few years has helped. If you looked at the report, you'll notice that our Vermont Emergency Responder Program, which is a new license level that we created with help of the legislature in 2020, has brought the number of EMS providers in Vermont, has maintained the number of EMS providers in Vermont. But what you'll notice in the data set is that the number of licensed providers in Vermont continues to drop. And even though we're seeing double-digit call increases year over year, we've actually seen a decrease in the total workforce available to respond to those calls from a licensed provider perspective. So I'm grateful that you guys are taking this up and looking at kind of providing support to EMS. I'd gladly answer any questions you have.
Questions? Ryan, Leslie?
I mean, we were taught, it sounds like multiple committee members have questions about training, and while we have you, and you can, this might also just plant the seed for like future testimony.
Yeah, let's just plant the seed.
Yeah, so maybe I'll just say, here's some things that it'd be good to hear about later. That what the current trauma-informed practices are that are being implemented, what health equity training there is. Some of it you probably won't know, but I would like to hear from the Health Equity Advisory Commission about their recommendations and how that intersects with the work of
And
EMS.
they are coming in next week.
Great, and then the Office of Racial Equity is probably going to weigh in on that too, because they have a plan, and I don't know if any of that has been brought to you all yet. So I think we need to make sure we're on the same page, because if you're doing the work of building the bill, making sure that the providers are taking that into account, like working on that language or whatever. So that would be something. And then curious about how regenerative practices might be implemented for EMS workers. And what I mean by that, because it's a newer term, is in the healthcare profession. There are some agencies like NFI Vermont, which works with youth and families, that are starting to implement practices for the staff that help them deal with the ongoing exposure to trauma. And you probably get exposed to some of the most trauma physically, mentally, that out of any provider. So I'd be curious to hear what the current practices are in the profession for helping workers deal with that, the support they need, and what kind of training might support that. So that now I've dumped it all out there, but then you heard it and you heard it.
Yeah.
So then we can arrange for the testimony, because ultimately I think we want to make sure that not only do you have teeth, but that you have the tools needed to sustain the workforce, not just monetarily, but I don't know what to call it, the social emotional support that healthcare providers haven't been getting. So
Good news is I have answers to some of those questions, but I'll hold them until the next time.
okay,
Perfect.
thank you.
Leslie?
My question was just about for the intent section, does that live with us? And,
It lives with them, but we can provide input if you want.
over to GovUp. So I'm curious at some point to hear your response to the intent section.
Okay.
Bobby?
Well, my question is something we talked about off record, but about how the training would apply to fast squads in smaller towns like Reigate. Probably they share a fast squad, but they don't really have a full-fledged EMS service.
Yeah, I'd be glad to kind of give some greater detail as to how that relationship between the first response squads and the ambulance services that really make up the system. So EMS is a system. Quite often we kind of get lost in ambulance service, but ambulance services are only part of our EMS system. So it's really important. And I'm glad to give you some numbers and data around how that interaction works and why it is so important in rural Vermont.
The 13 districts, do they include, are all of the EMS service providers included in those 13 districts? So when a representative comes from there, they are representing all of the EMS services in that area they're coming from.
Yes.
So what I'm worried about is the bigger services are the ones that are considered a district.
So
How do those small EMS services fit into that structure?
So it's every EMS service in the state is part of a district. There are 13 districts. They're centered around the hospital catchment area. The hospital actually is also part of the district. And each one of those districts typically have a representative that's been appointed to represent the interest of that entire region. I will say generally the participants are from the larger services, because the smaller services, as again, generally, the small volunteer services just don't have the time to commit to a lot of those meetings. So in our advisory committee now, there are, I think we said 22 seats. We typically see 7 to 12 people actively participating. The same 7 to 12 people all the time. There's some districts that, even though they have representation, we don't see.
I just really need some help understanding this. I'm gonna set up a district, okay? Barry City has an ambulance EMS service. Barry Town does. Barry Town is like a regional service, and Williamstown has a small ambulance service, volunteer service. Are they in one district here?
They are. That would be one district. So they're all in a single district. So and I don't know the exact boundaries down up in that area, but in our area, there are 12 towns, and the first response squads of all of those 12 towns, as well as the 2 ambulance services within those 2 towns, all make up one district. So the Barry kind of Montpelier area is probably all one district. I don't know the boundaries well enough to tell you, but
Yeah,
there'd be one
I
representative.
see Washington County.
that's probably it, right?
They don't follow necessarily county lines. They're more
Yes.
geographic, like around the hospital.
Well, see, this is what's confusing to me. Orange County and Washington County, they're two districts, but in fact, pretty quick, town of Orange and Williamstown are probably gonna be in Barry Town District, the Barry Town Service area. And the hospital that they're all serving is Central Vermont Hospital. See, I'm just confused about the district.
So the districts are they're historic. They've been around since kind of EMS was created in Vermont in the 70s. And they were really framed mostly because at that time, the medical protocol was coming directly from the physician at the hospital. Now in 2024, we have statewide protocols, so there's kind of less of that. The district boundaries do adjust from time to time based on service areas. So that one service, if the town used to be served by another ambulance service, and now that they'll adjust those boundaries to try to keep the service areas together. So sometimes those do change, but that's part of what we were hoping to get as part of the study that you funded last year. We had a lot of conversation about districts. Unfortunately, we didn't come to any really good recommendations around districts. So for example, our district has not met in 2 years. There's a representative from the district.
Yeah.
Not overly representative.
So essentially, they're not functioning.
There's some that function, but certainly not all of them function. And part of it is the way that they're created in statute. They don't really have very defined roles. Some districts have kind of incorporated themselves and created their own rules and responsibilities that they really don't have the statutory authority to do. And then others just don't do anything, like, the district I'm in, which is District 13. We don't meet at all.
Right.
So would this new board take on that task of making those more uniform?
So I think the goal was for the task force to really dig into what the structure should look like moving forward, because what we have for structure, we know has challenges. We know it's not functioning perfect in all areas of the state. Like I said, we were hoping that we would get a little bit more concrete work from our consultants this year, but
Yeah.
They told us we had a problem, but we already knew that.
Yeah.
So.
And it's disagreement amongst the districts
Oh, sure.
on how to do it. So yeah, task force would be a great idea to try and figure all that out. Great. Thank you, Drew. Appreciate it. Do you have?
My voice is kind of rough today. So
Okay.
I apologize. I'm happy to weigh in moving forward.
When the time comes,
Yeah,
great.
So I'm Kristen, with the professional firefighters.
Okay, great.
So
Great. Thank you very much for being here.
you're welcome.
Okay, so I will reach out to Chair McCarthy about getting this bill over to him, and we'll get Diva in to talk about the reimbursement and commercial insurance as well when the time comes.